Not getting a good night's sleep? Problems like sleep apnea are common in adults, but it's becoming more understood that children can also be affected by these conditions. Dr. Jose Colon of the Children's Hospital of Southwest Florida tells us that these disorders can affect a child's behavior, health, and ability to learn.
There's a lot of children that do have sleep disorders. There's more that we've learned about sleep medicine in the past 10 years than maybe potentially in the past 60 years in general. We continue to learn more about pediatric sleep disorders. One of the more common topics that's in the news is about obstructive sleep apnea. And in the pediatric population, 3% of children can have obstructive sleep apnea, whereas anywhere from 9 to 10% of children in the pediatric population can have what's called benign primary snoring. So the benign snoring is a little bit more common. The only way that you can tell the two apart is by doing the gold standard test, which is a sleep study, or also called a polysomnogram.
And these problems can start in preschoolers.
We can start to see more of an increase in the incidence anywhere from around 5 years of age, sometimes earlier or later, and that has to do with the proliferation of the lymphoid tissue, also called tonsils and adenoids. Towards the teenage population, that does actually begin the proliferation decreases some, and their airway kind of matures, and many times they can outgrow it.
What are the symptoms of sleep disorders in children?
When an adult has sleep apnea, some of the symptoms that we have is excessive sleepiness. In the morning, they're always saying that they're tired. They may have non-refreshed sleep. However, children don't necessarily speak our particular language. And a child that has a sleep disorder, they actually have problems with sustaining attention. They may have more problems with impulse control, even problems with learning as well.
Attention deficit hyperactivity disorder is linked with sleep apnea.
50% of children with ADHD also do have a sleep disorder. And it's a broad range, from obstructive sleep apnea to insomnia to behavioral insomnias, as well as another disorder called periodic leg movement disorder. And treating the underlying sleep disorder does help with attention in the daytime. One of the things that's seen in sleep apnea, both in adults and in pediatrics, is that your body is in what's called a stress state, a pro-inflammatory state, and it does make it difficult to lose weight. So people may be trying to lose weight, but if they are in this stress state, it makes it a little bit harder. Also, there's an increased incidence in diabetes, specifically in insulin resistance, and also you can have effects on the heart as well. Another common manifestation, another common symptom that we see in sleep apnea in children is one of bedwetting as well.
Dr. Colon discusses the treatments for sleep apnea.
With the pediatric population, the main treatment is removal of the tonsils and adenoids. But again, it is important to make sure that we actually have sleep apnea, because like I mentioned, 9 to 10% can have benign snoring, and taking out the tonsils and adenoids will stop the snoring, but if the snoring wasn't causing a problem, if it's not from sleep apnea. There are some populations that are at higher risk of still having the sleep apnea after the tonsils and adenoids are taken out. Obesity is one of them, so that's a time sometimes where after the tonsils and adenoids are taken out, we may need to repeat a sleep study to see if they do need CPAP.